Namaskar. My name is Lov Verma and I was Secretary Health and Family Welfare, Government of India in 2014-15, and I've spent a lot of time in the healthcare sector in the state of Uttar Pradesh also. I'm an Indian Administrative Service Officer of 1978 batch, UP cadre. I think the National Health Policy is a very welcome step it was formulated in 2017, but I feel that it must be made enforceable because we've been talking about these things a lot of times, but until it is made enforceable, it remains on paper and a lot of talk goes on. For instance, the policy says that we will spend 2.5% of our GDP on healthcare by the year 2025, but I don't see that happening. In fact, the health budget has been cut, so we really need to put our mouth where we need to walk the talk, as they say, and so it is important that whatever is committed by the government, it should be enforced, so it should be made legally enforceable. These are some of my views on the national health policy. Regarding the health norms for infrastructure, I think that they are laid out centrally, which is not the correct thing to do because each state is different and within the state there are so many differences. So it will be very important and then also health is a state subject. So it is very important for each state to work out for itself how many PHCs there should be, how many sub-centers, how many CHCs and so on. So I would like the infrastructure norms to be very broadly defined and up to the states to make kind of micromanagement on it and decide where to place which infrastructure. I think there is a great need for collaboration between the states because some of the southern states, for instance, have done very well in healthcare. Some of their interventions, like having a hospital corporation to do all the procurement, for instance, has been picked up by other states like Rajasthan. But we really need to take the best practices of each state and have it showcased at a national level. Maybe the Niti Aayog or some other national body could do this, and then that would be a win-win situation and a learning curve for all the states. Post-COVID, there's been a lot of introspection and also thinking about how the whole system had collapsed during COVID because the infrastructure was just not able to take care of the enormous load. So I think it will set states thinking about how to beef up the infrastructure. Plus, I think it will give a massive boost to telemedicine because we saw even in places like Delhi, people were contacting doctors over the phone, making payments over the phone, and receiving treatment and diagnosis over the phone itself. And how to tackle COVID was being done majorly on the phone. So I think that is the way to go for the future. I think Ayushman Bharat was definitely a game changer in the sense that it brought health insurance into the limelight and giving health insurance to the poorest of the poor. And the second aspect of it was the wellness centers. But I think the monitoring has not been as precise as it should be because of the sheer scale of the project. There are more than 1.5 lakh centers, sub-centers as well as PHCs which are due to be made into health and wellness centers. So there needs to be a very precise kind of program phase-wise and monitoring at the grassroots to see how it's being done because it's very, very ambitious. I find that is still lacking. And of course, the community participation has to be there. So a lot of NGOs have also entered the fray and they are doing good work. But overall, I feel that the monitoring aspect needs to be beefed up. Primary health care has really been neglected by all the states, with the result that about 70% of our population is actually going to the private sector. If you look at the overall picture, which is a very sorry commentary on the state of affairs. And this will only improve once the states as well as the center commit themselves to that 2.5% of GDP because we are vastly underfunded. Unless the funding improves, I don't see primary health care getting the importance it deserves. NGOs in healthcare, I feel have a very big role to play, because community participation is something we have been trying since the beginning of our planning programs and not really succeeding that much. So NGOs can really step in where the health systems are weak. For instance, I saw a sub-center which is being run by Wish, in which telemedicine plus an ATM, Swast ATM they call it, and it was in one of the remote areas of Rajasthan. They linked up with the Jaipur Medical College, so they were able to show the patients directly through telemedicine to these doctors who were sitting in Jaipur, and as soon as the medicine was prescribed, if it was available, it was made available to those patients that very day, that very hour, so to say. So that was a marvelous demonstration of how NGOs can beef up our infrastructure where it is really lacking. My association with WISH, which is Vadvani Initiative for Sustainable Healthcare, goes back a few years when Mr. Sunil Vadvani approached me, and he is like a mini Bill Gates. He's made his money in IT in the US and he's plowing it back totally selflessly for the health of Indians all over the country, with a massive ambition to touch more than 1 million lives soon, and we are heading towards that goal. So he struck me as somebody really committed and genuine, and we find very few of this ilk these days who are willing to put their money where their mouth is. And I feel that Wish is doing a great job. I really feel that Wish has a great future and I wish it all the best.